Joining us now is Assistant Admiral Levine. Thank you very much for being with us. First of all, when can we expect more vaccines to be made available? And you just saw what Antonio is reporting about the website is crashing. It is reminiscent of the rollout of the COVID vaccine.
Well, we will be expecting more shipments of the vaccine, the Jynneos vaccine from the company, and we have ordered more for future distribution throughout 2022 and to 23. Certainly, we need to coordinate with local, state, and federal public health to be able to address this significant public health threat.
How significant is the threat? Now, we understand that monkeypox is not transmitted the way COVID is through the aerosol transmission. It is usually through sexual partners, through fluid exchanges, but that still means that it is, it is very contagious, correct? And it is a real threat. Is this a pandemic?
So this is not a pandemic, and this is not COVID-19. As you've been saying, this is not transmitted through the air like COVID-19, but it is a significant public health issue that we're taking very, very seriously.
Dr. Rachel Levine is President Biden's pick to be the next Assistant Secretary of Health. If confirmed, she will make history as the first openly transgender federal official. Her nomination is attracting a lot of positive attention, but also some transphobic attacks from some big names about Levine's nomination. Jeff, wonderful to have you with us. Could you tell us more about this harassment? What's its nature? Where's it coming from?
Absolutely. Thank you for having me. So we're seeing a number of figures, media figures on the right who have, made these sort of statements about the nominee. For instance, podcaster Ben Shapiro has misgendered her in a tweet. Breitbart, the conservative media outlet, also misgendered her, as well as dead-named her, referred to her by her former name. And in fact, in that article, referenced that this was something that Dr. Levine had dealt with before, but still dead-named and misgendered her nonetheless. Tucker Carlson referred to her being transgender as, quote, her sexual orientation or sex life or whatever, which is not an accurate definition, as well as the attorney, a former Trump attorney, Jenna Ellis, who also misgendered her and then refused to apologize. Most notably, however, a state representative, Rep. Jeff Pyle, also posted something that was very insulting of her looks and then gave an apology, but it was an apology that was sort of a general apology that many said kind of missed the mark because it did not directly apologize to her or to the transgender community in general.
So Jeff, let's talk bigger picture here, because misgendering and dead naming certainly insulting and hurtful to Dr. Levine, but this is also detrimental to the wider transgender community. What is the broader concern here?
Well, we know that misgendering trans people is dangerous for their mental health. And one of the advocates that I spoke to for my article, Jillian Brandstetter, who's with the NAALC, she mentioned that there are so few trans people that are this prominent in public life, and that often when trans people see someone such as Dr. Levine treated in this way, that it can be very triggering for them as well, especially for trans youth. And they might get the impression that even if they achieve at the highest level, that these are the sort of attacks that could still be leveled against them, which is, can be very devastating.
I know you spoke with several LGBTQ advocates. What did they say about the importance of Dr. Levine's nomination beyond just public health?
Well, it's certainly a huge moment for representation. Again, there aren't a ton of openly trans people who are, well, in fact, no one has reached this historic level. If Dr. Levine is, in fact, confirmed, she will be the first person confirmed by the U.S. Senate for a federal position. So
We are joined by Dr. Rachel Levine. She's also a trailblazer and happens to be the first openly transgender federal official to be confirmed by the U.S. Senate. Dr. Levine, we appreciate you making the time to speak with us on this, the first day of Pride Month. More on that in just a moment. But let's start out with COVID in America. As we've been reporting, the country is opening up. Many are feeling relieved about that. But how concerned are you about the virus variants like the one just discovered in Vietnam?
Well, we are making significant progress in our battle against COVID-19. As you were saying, the number of new patients is going down, the number of hospitalizations, and the number of deaths. And with our safe and effective vaccines, we can see the light at the end of the tunnel, but we're not there yet. And we can't let our guard down, and we have to continue to dedicate ourselves to vaccinating hard-to-reach people.
And we heard today that Moderna is seeking full authorization. How soon do you think that full approval could come?
It depends, upon the approval process through the FDA and then consideration by the CDC. But we would expect that this month.
And what about specifically for children under the age of 12, with so many parents eager to get their young children vaccinated?
Well, we don't have a timeline for the childhood vaccines. That depends upon the science and the clinical trials that are ongoing. And so we will await the results of the science and when those clinical trials are complete.
And let's turn to the LGBTQ rights. Your department, HHS, made an announcement this month that it will enforce Title IX and also a section of the Affordable Care Act that prohibits discrimination on the basis of sexual orientation and gender identity in health programs and activities. Walk us through what this change looks like.
Well, this is a very important change because, of course, the size and scope of the Affordable Care Act is very significant in healthcare. So this is an interpretation of the ACA and Section 1557 that when the ACA refers to sex and not discriminating according to sex in all of its different programs, that includes, as you mentioned, sexual orientation and gender identity. And we'll be working throughout HHS to implement those plans.
What's your take on states trying to restrict transgender athletes from playing sports at high school and college levels?
I think that they're very challenging and unfortunate. I think that trans youth are very vulnerable. They have often faced significant bullying and harassment, and they need our support. They need to be nurtured, not to be limited from their activities such as sports.
Before HHS, you were Pennsylvania's Secretary of Health, leading that state's pandemic response. You certainly won a lot of praise in that role, but there were also some ugly incidents like bigoted statements or that Bloomsburg fair where there was a dunk tank appearing to mock you. You reportedly said in 2016 that with few exceptions, being transgender has not been an issue. Do you feel that changed at all as your role became more public?
Well, I am laser focused on my public health mission. And that was true at the Pennsylvania Department of Health and now true as the Assistant Secretary for Health at HHS. And that includes, of course, COVID-19, the increasing number of overdose deaths that we're seeing, health equity, and many other programs that we need to work on and achieve in public health. That's what I'm focused on. But this is Pride Month, as you said, and I think that it is very important to advocate for equality and health equity for the LGBTQ community.
And lastly, kind of piggybacking off of that, what do you feel are potentially the most harmful misconceptions about transgender people, particularly in your field of public health?
Well, transgender individuals such as myself are really just like everybody else. And so that is why I'm so grateful to President Biden that he nominated me to this position, and so grateful to the Senate for approving me with a bipartisan vote. And now I'm going to dedicate myself to my public health mission. And that is the same as transgender individuals across the country doing good work throughout our nation.
Dr. Rachel Levine, Assistant Secretary for Health at the HHS, we thank you so much for your time. Appreciate you joining us tonight.
They stress that really, the main thing here is that she is qualified for the job. She's the right person for the job in their minds because of her experience, but that is also a big moment for the trans community and the LGBTQ community broadly in terms of the representation.
All it takes is seeing one person doing something for you to believe that you can do it too because you're like them. Jeff, I want to ask you about one more bit of controversy. Dr. Levine took some heat for pulling her mom out of a care facility last year while Levine was the health secretary of Pennsylvania. But there was some misinformation tied up in that criticism. Could you kind of just take us through what happened there?
Sure. So her mother, a 95-year-old woman, was in a personal care facility, which she was then removed from. And this was at the same time when there was a policy in place to place those who were in nursing homes back into their nursing homes, even if they were COVID positive, but they were stable. And so some people saw this as, you know, a problem, as sort of a hypocritical moment. Dr. Levine has noted that, in fact, there is a difference in terms of who oversees, the personal care facilities. That's under the Department of Human Services. She ran the Department of Health, and also noted that it was her mother's decision, that she was perfectly capable of making that decision, and also that in choosing to have people go back into nursing homes.
Is it limited to men who have sex with men, transgender or non-binary individuals? You know, give us a sense of the population or how widely spread it is in the general population.
Well, it's important to remember that anyone can contract monkeypox, but right now the community most affected is the LGBTQI plus community, particularly, as you said, men who have sex with men. So gay and bisexual men have been most impacted, but it does have the potential to spread, which is why we're working in the federal government with state and local health departments for containment. We've significantly increased testing and to want them to be working on contact tracing with isolation and quarantine. And then we are distributing all the vaccine that we have and purchase more, and we'll continue to distribute that. And there are effective treatments. Now, the vaccine and treatments were originally designed for smallpox, but they are effective against monkeypox.
We've got a press release here from Sonicare, Sonic Healthcare USA, which is quoting Rochelle Walensky, Dr. Walensky at CDC, saying that there is an agreement with this company for better testing, so that you would have better data. I assume that is an official announcement.
So we are increasing the amount of testing throughout the country through LabCorp and many other commercial testing companies to make sure that we get more information and more data about the extent of the spread of monkeypox, which gives us much more information in order to address it.
Also want to ask you about COVID, because the most immune evasive subvariant is driving cases up. Hospitalizations are also rising. We know that a booster is going to be available in September. But how concerned are you about the summer surge? And will that booster be after the surge? Will it be really too late?
So we are certainly still concerned with COVID-19. The pandemic is not done yet, and we're concerned, as you said, with the rise of particularly the BA.5 variant, which seems to be the most contagious variant yet. But we know what works. We have the tools in the toolbox in order to address this, and that includes our safe and effective vaccines and boosters, as well as testing, which is available throughout the country, and then wearing masks according to the CDC guidelines, depending upon the amount of community spread in the area in which you live.
I want to ask you also about transgender Americans, because you're the first openly transgender official confirmed by the United States Senate. In a recent op-ed, you urged people to base medical decisions and public statements on real data and compassion rather than slander. And you spoke to trans youth in Florida recently. Tell us what you told them.
Well, you know, trans youth are vulnerable, and they suffer significant harassment and bullying, sometimes at schools or in their community. They have more mental health issues, but there's nothing inherent with being transgender or gender diverse which would predispose youth to depression or anxiety. It is that harassment and bullying. Now they're suffering politically motivated attacks through state actions against these vulnerable transgender youth. This is not based upon data. These actions are politically motivated, and so we really want to base our treatment and to affirm and to support and empower these youth, not to limit their participation in activities in sports, and even limit their ability to get gender affirmation treatment in their state.
No, you chose Florida, of course, the home of the Don't Say Gay bill, of course, which has been notably restrictive.
So that is correct. You know, the studies show from the Trevor Project that all it takes is one supportive adult to make all the difference for an LGBTQI plus youth, transgender youth, in terms of their risk of depression and suicide. One supportive adult. That often is a teacher or a school personnel, and the Don't Say Gay bill is very damaging to their health.